Hello and welcome. Today, we're diving into a condition called ischemic colitis. We'll explore what it is, what causes it, and how it's managed. So, let's get started on understanding this important digestive health issue. Ischemic colitis occurs when blood flow to the colon, also known as the large intestine, is reduced. This lack of blood deprives the colon cells of oxygen, leading to damage and inflammation. The most common causes are reduced blood flow from conditions like atherosclerosis, where arteries become narrowed and hardened, or low blood pressure. Other risk factors include blood clots, hernias, certain medications, like diuretics or non-steroidal anti-inflammatory drugs, and surgical procedures affecting the abdominal aorta or colon itself. Imagine the colon as a complex machine requiring constant fuel, in this case, oxygenated blood. When this blood supply is compromised, the cells lining the colon begin to suffer. Initially, this causes inflammation and swelling. If the blood flow isn't restored quickly, the colon lining can develop ulcers, bleed, and in severe cases, tissue death or gangrene can occur. The area most vulnerable is often the watershed regions of the colon, like the splenic flexure and rectosigmoid junction, where the blood supply is less abundant. Ischemic colitis is more common in older adults, typically those over 60, because the risk of vascular disease increases with age. However, it can occur in younger individuals, particularly those with underlying health conditions that affect blood flow, such as vasculitis or blood clotting disorders. While precise numbers vary, studies suggest that the incidence rate increases with age and the presence of cardiovascular risk factors. It's a condition that impacts thousands of people each year. The symptoms of ischemic colitis can vary from mild to severe. The most common symptom is sudden abdominal pain, often on the left side, followed by a strong urge to defecate. You might also experience diarrhea, which can be bloody or mixed with mucus. Other symptoms can include abdominal tenderness, nausea, vomiting, and fever, especially if the condition is severe. It's important to note that the symptoms can sometimes mimic other digestive disorders, making accurate diagnosis crucial. Diagnosing ischemic colitis typically involves a combination of medical history, physical examination, and diagnostic tests. A doctor will likely ask about your symptoms, risk factors, and any medications you're taking. A colonoscopy, where a flexible tube with a camera is inserted into the colon, allows direct visualization of the colon lining to identify inflammation, ulcers, or other signs of ischemia. Imaging tests, such as a CT scan with contrast, can help rule out other conditions and assess the extent of the affected area. Additionally, blood tests can help assess overall health and rule out infection. While ischemic colitis doesn't have strict classifications, it's often categorized based on severity and duration. Transient ischemic colitis is the mildest form, where symptoms resolve quickly with treatment. Chronic ischemic colitis involves ongoing inflammation and symptoms, often related to persistent reduced blood flow. Fulminant ischemic colitis is the most severe form, characterized by rapid tissue death and a high risk of complications. Treatment for ischemic colitis depends on the severity of the condition. Mild cases may resolve with supportive care, such as intravenous fluids, bowel rest, and antibiotics to prevent infection. More severe cases might require hospitalization for closer monitoring and more aggressive treatment. In cases of severe bleeding, bowel perforation, or gangrene, surgery to remove the affected portion of the colon may be necessary. Pain management is also an important aspect of treatment. While it's not always possible to completely prevent ischemic colitis, there are steps you can take to reduce your risk. Managing underlying health conditions, such as high blood pressure, high cholesterol, and diabetes, is crucial for maintaining healthy blood vessels. Regular exercise, a balanced diet, and avoiding smoking can also improve cardiovascular health. If you're taking medications that might increase your risk, discuss alternatives with your doctor. The prognosis for ischemic colitis varies depending on the severity and extent of the condition. Many people with mild to moderate ischemic colitis recover fully with appropriate treatment. However, severe cases can lead to serious complications, such as strictures, chronic colitis, or the need for surgery. Ongoing research is exploring new ways to improve diagnosis and treatment, including potential therapies to protect the colon lining from damage and improve blood flow. Scientists are also investigating the role of gut bacteria and inflammation in the development and progression of ischemic colitis.